Hi, I'm Dr. Stephen Gowdy, Pediatric Ear, Nose, and Throat Surgeon and Chief Medical Officer of Dr. Knows Best. One of the things that I see frequently in the office are ear infections. And so lots of kids get ear infections. Almost every child by the time they're 2 years of age has had an ear infection. So they're very common. Sometimes if your child is in daycare or there's a family history of ear infections, you may end up having back-to-back-to-back ear infections. Usually Saturday night at midnight, your child is crying, they have a fever. If they're old enough, they may tell you it's their ear. And so parents are left wondering, what do I do? How do I make my child feel better? And what really physiologically or structurally is going on that's leading to so much pain? If you're an adult and you remember having an ear infection, you know that it really hurts. So one of the things that you can do is that you can really just massage or rub on the ear here. So you can see all these yellow things are nerves here. So you can massage gently the back of the ear. May help relieve some of the nerve pain that they're having. Obviously maybe even a warm compress or your hand just to kind of cradle their ear to make it feel a little bit better. The other thing that you can do, ibuprofen, depending on their age, and Tylenol, which is weight-based, that can reduce any of the inflammation or the pain that they're having, and using those alternating every 3 hours, meaning that you give ibuprofen based on the weight, based on your pediatrician or your pediatric healthcare provider giving you that okay, and then 3 hours later, then giving them the Tylenol and the acetaminophen, and then alternating every 3 hours. The third thing that you can do is clean out their nose. So the nose gets really congested when your child has a cold and usually has an ear infection. The congestion in the nose leads to congestion in the back of the ears. So cleaning out the nose will help. And so if this gets all plugged up with mucus, the ear actually drains back here at the back of the nose. So if this is completely blocked, then all of that infection can't drain out. So really working on cleaning out the nose will help your child feel a little bit better, less congested. Obviously breathing and eating and all that will get better as well. But if ultimately what we want to have happen is all of this congestion and mucus to clear out so that the ear, which again, the ear is here. So if behind the eardrum is connected to the back of the nose here, we want that to really open up and clear out. So really to help your child feel better, make sure that they're well hydrated. Hydration is another big important thing to help your child feel less fussy, less irritable. It can help get all of that mucus out as well, and certainly you don't worry about dehydration and so on. So really some gentle massage at the back of the ear, some warm compresses, not hot, right? So feel them with your hand, your finger, your face before you would put those on there. Using Tylenol and Motrin to reduce the fever, reduce the pain, clean out the nose to let that back of the nose drain a little bit better. And then ultimately you need to see your pediatric healthcare provider to ensure that there's nothing worrisome going on. If there is a bacterial infection, to treat it. If it's a viral infection, just to know that it'll go away. So those are some simple things that you can do at home if you feel like your child has an ear infection before you actually are able to go and see a physician or a pediatric healthcare provider. From Dr. Knows Best, I hope that that's some helpful information, and follow us for more great tips.